Hello, welcome back to the Knowledge Well. My name is Dr. Eva Zingone, and today we're talking about chiropractic care for kids and for babies. Our little ones today are under a tremendous amount of physical, mental, emotional stress, and chiropractic is a really great, healthy habit that is preventative and can help children deal with stress and adapt to the rigors of their daily lives, whether or not they are dealing with any specific challenges or problems. It is also a great strategy to bring them out of times of challenge and help them overcome specific obstacles that they might be encountering in their day-to-day lives. We're going to talk about the benefits of both. I am a certified perinatal and pediatric chiropractor. I practice with my husband in San Diego, and we've been working with moms and newborn babies and kids over the last decade. An overview of what we're going to talk about today. We will discuss why little ones need chiropractic care, how it's profoundly different from care for adults. Obviously, little bodies that are still growing have very unique needs, and adjusting a little kid is not the same as just adjusting a tiny adult. They have their own unique needs and considerations. I will share with you what you can expect at a typical visit, and I will, of course, give you some action steps, some strategies that you can utilize at home to help your baby or your child adapt to stress and be healthier, whether or not you have access to an awesome pediatric chiropractor. So we've been talking in these last couple videos about the nervous system, and this is the part that remains the same with chiropractic no matter who we're talking about, whether it's a newborn, a pregnant mama, or a senior citizen. The nervous system is what regulates our response to stress. We experience life through our nervous system. We take in information about our environment through all senses. We process it in our brain, and the brain sends information back out through the nervous system so that we are always appropriately responding to the world around us. The nervous system is one of the first systems to develop in utero. It is so crucial that the body protects it, the brain and spinal cord, with your skull and with the bones of your spinal column. Now, sometimes parents will ask me, all right, we're talking about the nervous system. This is what allows us to adapt to stress. What kind of stress does my baby have, though? It seems like they live a pretty simple life, right? Eat, poop, sleep. That's all their body ought to be really focusing on doing. However, babies do experience stress, not in the same way that we think of it typically as adults, or even like as thinking about older kids experiencing stress, whether they're playing sports or they've got homework and school stress. Baby's first exposure to stress is actually in utero. Baby is experiencing what mom is experiencing to a certain degree, and they're kind of like two nervous systems in one, because mom is going about her life responding to the environment around her. And if mom is experiencing a lot of stress, she's releasing a lot of stress hormones, baby is bathing in those stress hormones, it is going to start to wire their neurology. It's going to start to wire their brain to anticipate stress, and they're going to be guarded for safety. And it's going to be reflected in their nervous system when they are into the world. Now, on the other side of that, if mom experiences stress throughout her pregnancy, but she's able to resolve and to clear that stress, baby's physiology gets to experience resolving stress and the healthy way to cope with stress, which is not to avoid it entirely, because of course it's part of life, but how do we use it for good to make our system stronger and more resilient, rather than allowing it to fester and hinder our performance or our experience of life. The next big stressor that babies experience is birth, their journey into the great big world. And it doesn't matter how baby's born, whether it's an uncomplicated, unmedicated vaginal birth, or a C-section, or a 42-hour labor, or an 8-hour labor. Each can be very stressful for baby in its own way. And you think about birth from baby's perspective, right? Being squeezed forcefully for hours and hours on end, making their descent through the birth canal, being squeezed out or being lifted out of the uterus by their head. There's a tremendous amount of pressure placed on baby's head, no matter the mode of birth, very oftentimes in the upper neck and the head, right? And there's a lot of really sensitive neurology here that we're going to discuss on subsequent slides, areas of your nervous system that regulate your heart rate, your breathing, your digestion, and a lot of challenges that babies have in the early days, whether it's colic or reflux or difficulty doing their three main jobs, eating, pooping, and sleeping, can actually be traced back to stress from the birth process, whether it is physical stress and physical guarding, physical damage that was done, whether it was the use of forceps or vacuum extraction or any other sort of like physically forcible or physically forceful experience, or it could simply be them imprinting the emotional stress of that process. The takeaway here is that regardless of the mode of birth, this is a big deal for mom, but also for baby. And when we consider things from baby's perspective, we can start to understand the ways in which baby's ability to respond to future stress and their health and function overall can often be traced back to the birth process, and how unwinding that stress very often can help babies thrive. And it's something that not a lot of people or providers are necessarily thinking is relevant when it comes to the 5 or 6-year-old that's having recurring ear infections and asthma. But you'd be surprised perhaps how oftentimes we find when we do a thorough history on a child and we're exploring some of the causes of interference in their system, we discovered that the birth was really traumatic for mom, for baby, and that it was something that the parents felt never really got resolved, or that the baby never really had an outlet to work out that stress. And it's something that we just sort of glossed over and moved through. And birth is not something to gloss over. This is a really, really significant event in everyone's lives. Now, following baby's journey now to the next stressful milestone, it's adapting to the world as an infant. The stress of feeding, whether it's breastfeeding, bottle feeding, it's a new skill that exists for baby and for mom, and it can be extremely challenging and stressful. Once baby starts to toddle around, they're learning to walk. Well, now it becomes a little bit more obvious how their systems are exposed to stress, because you're seeing them fall dozens and dozens, maybe hundreds of times a day. When they're learning to walk, they fall on their butts, they face plant, they fall off of furniture, and it can be really cringeworthy and really hard for us to see our precious little babies explore the world and explore their bodies. And part of that learning process is falling and learning to get up again. But whether it's a big fall or even a small one, it really adds up over time. And as they are learning to coordinate their little bodies in space, we can see how stress can build up in the system, and how chiropractic can be a strategy to not only help resolve that stress and restore alignment as their bodies are continuing to grow and develop, but also increasing their brain-body awareness and improving their coordination and helping them explore their world in an increasingly safer way. The nervous systems of older children continue to be extremely attuned to the nervous systems of their family, of their primary caregivers, of those around them, of the other children at school, of overall tension and stress and anxiety, unease, worry in their environment, at their school. So it's really important that we are supporting their emotional health and their ability to navigate emotional stressors just as much as we are supporting their ability to navigate the physical stressors. Now, I like this analogy of a water bucket when we talk about the way that stress accumulates over the course of a lifetime. It's like water filling up a bucket. You get a little dash of this here and a dash of that there, starting from in utero for a child. And as stress builds and builds and builds, water fills that bucket up and up and up and up until it reaches a point where we have exceeded our body's capacity to adapt to that stress. And any additional stress, any additional water that tries to fall into that bucket, well, there's nowhere for it to go. So it just pours out. This is usually the point in which our bodies start to really communicate to us that they are at full capacity. They can't handle anymore. For a child, this may manifest as difficulty focusing. It may manifest in a younger baby as the colic, reflux, constipation. It could manifest as asthma or autoimmune issues. It's simply the body not being able to adapt to its current state, and it's requiring and it's asking of you to implement some sort of strategy to help it recuperate, recover, to get some of this water out of the bucket so that we can once again start to take on the daily demands of life and not let it overcome us and overwhelm us. Now, in our modern society, I think most of us are accustomed to waiting until the bucket is overflowing to take action or to seek help. And a lot of people will only ever see a chiropractor or another form of healthcare provider when they're having pain or when they're having symptoms or when they're having challenges. And part of what I love about being in a family practice and getting to work with kids is that we get to shape their understanding of the world, and we get to teach them through example better and more effective strategies of caring for themselves. So I'm always educating kids about the fact that if their water bucket is full, we got to figure out how to pour some of that water out so we've got more space to adapt to life stressors. It's not necessarily the best strategy to wait until the bucket is overflowing every time, because it's going to take a lot more work then when we let the body get to that point than if we were just proactive and we made sure that, well, as the water's coming into the bucket, we make sure that we're draining some water out at an equal rate. So we got water coming in, water bailing out, and the bucket never overflows. I tell parents that every time we get a chiropractic adjustment, it's like poking a little hole in the side of that bucket and just draining some of that water out. The specific ways in which chiropractors help the function of the growing and developing nervous system in a child is by working with the vagus nerve. The vagus nerve is also known as the wandering nerve. Vagus means wanderer. And it is one of those nerves that I talked about when we talked about birth trauma that is located at the very, very upper neck. So right where the skull meets the neck here. And it exits the skull and it travels all the way down. So you can see in this image here that the nerve exits right up here. It makes all of these various stops along its journey throughout the body. It stops at our lungs and our heart and our digestive organs, and it controls that stress response. So it can create a calming response in the body. It can help our digestion, our breathing when we're feeling safe and at ease in our body. But if we are perceiving threat or a lack of safety, it can initiate that fight or flight response where our heartbeat speeds up and our brain says, I don't care about digestion right now. I'm in survival mode, and it shuts all those things down. The vagus nerve is, there's a portion of it that regulates, it's called the social engagement system, and it regulates our social development in the sense that there's a portion that is responding to the environment in terms of like social cues, facial expressions that other people are making. If we are in an environment where we feel safe with other people, we're able to respond to them appropriately. It feeds that signal of safety throughout the entire body. And conversely, if we don't have those healthy relationships, we don't have that ability to engage socially, it can shut down portions of the vagus nerve and create that fight or flight response and create sort of a feedback loop of not feeling safe and not being able to engage socially. So one of the functions of a really healthy nervous system in a child is healthy relationships and healthy social development, where they're able to respond appropriately, not just to the stressors in their environment, but to people in their environment. And so this is just one example of one of the nerves in the body and all the important functions that it has. And part of our job as chiropractors is to regulate and balance the function of this aspect of our nervous system so that kids can continue to grow up healthy and happy the way that they were designed to be. So in our office, when a child comes in, whether they're having specific challenges that the parent would like help with, or whether a parent simply wants to have them checked and be under care preventatively to make sure that bucket doesn't overflow, part of our assessment is we do these insight scans. And depending on the age of the child, we want to measure various aspects of the nervous system to see how efficiently it is functioning. If we are doing scans on a newborn baby, we might measure the portion of the nervous system that controls the organs and glands and look for any areas of inflammation or interference in that system. If it's a slightly older child that is holding themselves upright, we may also measure the amount of energy in the postural muscles and how that energy is distributed. It gives us a lot of information in terms of how the child is developing and utilizing energy in their motor nervous system, which is their movement system. We also do a scan that takes heart rate variability, and that shows us how well that child is adapting to stress in their environment based on indicators from their heart rate. These scans are very versatile, and for children can often be done while they are playing or while they're snuggling mom. They're completely painless. They don't involve any radiation. For younger kiddos or kiddos with sensory sensitivities, we have a lot of different ways to adapt that heart rate variability scan. For example, we have a special ear clip that can be placed on the ear or on the finger, a little special finger sleeve. There are so many different ways that we can modify the exam. And our primary goal, as should be the goal with any office that you find for your child, is that the child's comfort should be number one, and nothing should ever be forced upon the child. We just talked about how safety is so crucial to functioning of the nervous system. It's so crucial for a child to be able to heal. We want to make sure they feel safe in the environment. It's absolutely critical. So if we need to break up the exam over 5 visits, 10 visits, we'll do it. We got to work at the child's pace and meet them where they're at in order for them to get the best results with chiropractic care. Now, the adjustments themselves, there are so many different techniques, like I have mentioned in these previous portions of this presentation when we talked about pregnancy, before and after pregnancy. Adjustments can very often be done in any position. When we're talking about newborn babies, you can see here I'm adjusting this baby and actually one of our pregnancy pillows. These are the pillows that mom can lay her belly in when she's getting adjusted. You can see that we then can use them for baby, and baby lays in that little cutout for the belly. And we're able to do our gentle work. Oftentimes with little ones, we're using sustained contacts with our hands, and it's no more pressure than you might use comfortably over your closed eyeball or your closed eyelid. Or I'll also tell parents it's kind of like the amount of pressure you'd use to check an avocado to see if it's ripe. Doesn't take a lot of force when we're able to be very, very specific, because we have the information from our exam to indicate exactly where that child needs assistance in their nervous system. With an older child, with a toddler, we often use these tools, these clicker tools. It's called an activator. You can see that mom's holding a little toy version of that tool that children absolutely love to play with. A child can be, I adjust children on the floor every day while they're playing with puzzles or playing with Legos, but we are able to modify and adapt our technique in order to suit the child's comfort and the child's needs. All right, parents, let's talk about what you can do at home to improve the health of your child's nervous system. I'm going to give you some strategies for newborns that are as young as days or weeks old, and I'm going to take you all the way through teenagers. So let's get started. One of the questions I often get from parents, especially first-time parents, is what do I do with my baby all day long? Especially when the baby is really little and it seems like they're just kind of laying there. You don't know whether to engage them, how to engage them. And engaging them in intentional play can help them reach their milestones, can help facilitate development. But the big picture is that much of childhood development happens on its own, regardless of you doing anything to create that development. It just sort of happens. But that being said, I'm going to show you some intentional things that you can do with your child at different stages to help improve their brain-body awareness. So proprioception is the word we use for the brain being able to sense where the body is in space. And this is a really important sense for babies to develop because it feeds into the development and awareness of their postural muscles, their balance and their coordination. And really the best way that we can facilitate this in babies is to give them free body play and time to explore and move their bodies without being contained. So the less time we can spend in things like car seats or baby bouncers or walkers or anything that, again, is restricting their movement, the better. Now, obviously, a lot of those things exist to make life more convenient for parents, and there may be a time and a place for all of those things. I'm not saying that you have to throw them in the dumpster right away. I'm just saying that you want to make sure that for as much time as a child is spending in a container, you want to give them at least twice as much time to spend on the floor playing. So I gave the example of a tiny little infant. Of course, wrapping the infant is a great way for them to start to develop that proprioception. But for the little ones, tummy time is going to be the most beneficial for them developing the strength to eventually lift up their head, developing the neck strength needed, and also the core strength and that body awareness. And tummy time can happen in a number of different positions. For little ones, it's nice to just have them laying on your chest. I'll show you how you can do tummy time on a ball to encourage a little bit of movement. Of course, tummy time on the floor, you can roll up a little towel and put it underneath their forearm so they can sort of be propped up. For a little baby, for them to only be able to hold up their neck for a couple of seconds is normal. They don't develop that head control for at least a couple of months, usually about 2 or 3 months. It is important to just create those opportunities and to be patient. And if baby really doesn't like tummy time, it's usually an indication that there may be an imbalance and they may be physically uncomfortable with that, or it's something that you just need to very, very slowly work your way up to exposing them more to. In addition to tummy time, another strategy you can use with a young infant and newborn is baby massage. This is a great way to improve body awareness. It's a bonding activity that the two of you can do together. You can do this with or without a onesie on the baby. You can do this with or without oils. You can either make it a whole little ritual. You can do it after bath time. Obviously, make sure that the room is very warm. You can lay them on a warm towel, use a little coconut oil. Or I would just do this with my baby in his onesie before bed. I would do it as sort of a casual thing. With baby massage, you want to obviously use a very, very light touch. You can let it be intuitive. There are a lot of different sort of techniques that exist with touch and with massage, but really just like intuitive feeling and touching is baby massage. And if you want to be more methodical, you can start with baby lying on their back. And you can start with, I like to start with the center and just sort of gently stroking the chest. You can move outwards from side to side on the ribs. This can be really nice. You can do little circles like so. A little tummy massage can be nice if baby's having digestive challenges, if they're having gas or constipation. I teach a tummy massage that's called the I Love You massage for tummy. And you basically start at the bottom right corner, right sort of where the leg meets the hip crease. And you're just ever so gently gonna move up until you reach basically the bottom of baby's rib. Then you're going to come across like so, and then you're going to go down to the other opposite hip. So hip up to rib, across, and down. So you're making an I, then you're making an L, then you're making a U. And this is basically helping to trace baby's digestive tract. You could also just do simply some clockwise circles. It can help things sort of pass through and move through. Arms and legs, again, if baby's on their belly, you can just gently stroke down the leg. You can get the foot moving up with your thumb on the foot, little circles. You can do a little gentle mobility of the ankles. Same thing with the arms. You can just gently work your way downward strokes along the arm. Just think about what would feel good in your body. And if baby is not having fun with this experience, you can stop. It's not something that you want to create a negative association with. Another symptom-specific massage technique that I will teach parents that can help with congestion. It can also help with ear infections and just like fluid not draining from the face efficiently, is to do a little gentle sinus massage on the babies. So what we'll do is come to either side of the nose and then just gently right above the forehead. So you can just do little, and I'll use my pinky and I'll just do a little sweeping motion like so. You can do one side at a time like so. You can go right above the brow, one side at a time like so. You can do a little gentle tapping motion or a sweeping motion. For the ear, what you can do is a little gentle massage from the front of the ear down and along the side of the jaw. So again, I would use my pinky because it's just super light, and I would go down and then I would go along the jaw like so, helping to drain the ear. You can do that on the other side. Again, this is nice to do as a wind down, maybe after bath time, because it's super relaxing for baby as well. As your child is exploring their body more and more, once they're starting to become mobile and they're scooting around, crawling around, army crawling, it's really important to give them a varied terrain to work with to build that proprioception. We want to make sure we're challenging their stability so they're able to learn how to kind of calibrate their body movements appropriately. Part of this learning process is falling. So I encourage parents to have a falling safe space for their child, and it's not that you're necessarily encouraging them to fall, but I mean, you kind of are, because that's how they learn. And as parents, we don't want to see our children fall. We want to protect them as much as we can. I've seen these devices where it's like a backpack that the child wears, and it has a little, almost like a little headrest along at the top of the backpack so that the child wears it. And then if they fall, bam, they don't hit their head, they fall on this cushioned backpack. Kind of a cool invention, but that is going to change the feedback to the brain as the brain's trying to calibrate. Okay, if I shift this amount, I'm okay and I can recover. But if I shift this amount, I topple over. Well, we're really hindering that by changing the baby's center of gravity and by introducing this foreign object as the body is trying to calibrate. It just sort of shifts everything off. So you want to just like let them be in their body. If they're not going to be wearing a backpack like that every day for the rest of their life, you want to help them develop this sense just on their own. So if you don't have carpet, there are padded play mats. There's a ton of those that are available. I would invest in a padded play mat so that the child has a safe space to explore, and making sure that they're having a variety of terrains. So of course, being outside in the grass is important. Also, you can get play structures. This is called a nugget, where it's basically, we joke that it's like expensive couch cushions, which is kind of is, but they're really cool because they're designed to be mixed and matched. There's little triangle wedges. There's these flat pieces that can be folded to make a little tunnel. Children can climb over them, through them, and really, again, it helps them to calibrate that balance, that body awareness. And then as they tumble, they have a soft surface to tumble on if they're using something like this. So this, or just like couch cushions, is another great option as your child is exploring movement. Another really crucial element as your child is starting to explore more with their body, as they're becoming mobile, by the time they're crawling, you really ought to be giving them as much time as possible not wearing shoes or socks. And I know this can be hard because baby shoes are like the cutest thing ever. And you just want to buy all the shoes and like tiny little like Vans, like they just absolutely kill me out here in California. I just think that's the cutest thing, little baby boots. But weather permitting, when you guys are inside, you definitely want to give baby time barefoot as much as possible, because having a child's foot in a shoe at all times, or a sock, it's like having your hand in a mitten versus a glove. When your hand is stuffed into a mitten and you're trying to like cook something in the kitchen, or you're trying to write, or you're trying to text with your phone, like you just have almost no dexterity, versus if you have your hand in like a glove, there's at least some movement there. But if your hand is free, you can do all the things with your hands. It's the same thing with the child's foot. And the foot provides so much feedback and information to the brain about the surface that we're walking on. Again, that sort of like balance and body control and postural muscle development. A lot of that information comes through pathways from the foot, from the ankle, directly to the brain and back down. So we're interrupting that feedback loop for proprioception when we are hindering the function of the foot by stuffing it into a sock or a shoe. So certainly by the time your child is walking, as much as possible, when you're at home, when you have control over these things, create an environment that is warm enough and safe enough for them to be able to walk without socks or shoes. It is so crucial for their development in all ways. One of the challenges as your child starts to grow older and older is that they're going to start embracing technology in one way or another. No matter how much you try to limit or control screen time, the devices are now in schools. They're going to make their way into the life, probably in some way, shape, or form. But not just devices that we use like phones or iPads, but even like books. There are a lot of postural considerations that we can strategize around to help optimize growth and development, to limit problems and injuries as they're using these devices over time. So my biggest tip here for kids is to position the device in various ways so that the posture is always changing. When we're just seated in one position, a half hour goes by, hours go by, right? You felt that feeling in your body when you go hours and hours without changing position. So I want you to remember the magic number when it comes to using devices, and that's 20 minutes. 20 minutes is the magic number. It's about the amount of time that our body can be in any given position before issues start to happen. So utilize technology. Put an alarm on the phone, an alert on your smartwatch or your child's smartwatch or whatever device they're using, so that every 20 minutes they have to change positions. So obviously this is sort of the default position where we're just hunched over, we are on the phone like this, and we go further and further down until we're completely hunched over. And this is going to really wreak havoc on the natural curves of our spine that are developed to give us strength and stability over the course of a lifetime as we grow and as we move as humans under gravity. So we really want to protect the development of those curves at all costs. So the child can be sitting like this. You want to encourage them to lift the phone or the iPad or the device up to eye level so that their body is going to follow wherever the device is. If the device is down here, the body's going to crumble to meet it. But put the device up here, and the child will have to raise their body. This is a much better position for using the device because it puts me in the opposite position than I was when I was seated and hunched all the way forward. This way I get to extend my back, I get to strengthen my back, I get to strengthen my neck by looking up, and I can simply hold my device like this. So this is a much better option. This would be a great position to change to at the 20-minute mark, and I can switch back and forth. For teens that tend to have a little bit less energy anyways, even just having them on their back and using their phone is better for their posture than seated. So here's another option. I'm on my back, my body, my spine is in neutral. So I got this cord in the way. But my back and my spine is in neutral, and I'm holding the phone right above me to use it like so. This is another great option. Now, this applies not just to phone usage, but whether your child is an avid reader of books or whether they're doing their homework, just keeping in mind that magic number at the 20-minute mark. You want to keep the posture fresh, keep switching it up. We just want to avoid spending hours and hours and hours in the same exact position. Thanks for tuning in. If you have questions about chiropractic care for kids or for babies, part 4 of this series, we're going to do a Q&A, and I will be answering your questions. You can also check us out on social at Pregnancy Tribe. See you soon.